Today my presentation topic is pathophysiology of the Hashimoto disease and its clinical diagnosis. My name is Kirsten. What is Hashimoto disease? Hashimoto disease is a form of autoimmune disease which disorders thyroid cells by cell and antibody-mediated immune process. It is more commonly in women and elderly. It is a typical type of hypothyroidism in iodine sufficient area. It can also cause inflammation of thyroid with enlarged goiter. Cause of the hypothyroidism. The major cause could be the disruption of the thyroid gland that related to genetic, familiar cause of any thyroid disease. Environmental factors that trigger the disease. For example, diet intake. Just like the patient in our case probably had excess iodine intake because of her normal seafood diet. Other autoimmune disease can increase the risk of Hashimoto disease as well. Risk factors. There are many risk factors can be associated with this disease. For example, the concurrent autoimmune conditions such as diabetes, adrenal insufficiency, celiac disease, and pernicious anemia. Family histories of autoimmune disorder, pregnancy, high iodine intake, radiation exposure, Turner and Down syndrome, postpartum thyroiditis, also risk factors for Hashimoto. Let's talk about pathophysiology of the Hashimoto disease. Thyroid epithelial cells, which is a thyrocyte, are progressively depleted and gradually replaced by mononuclear cell infiltration and fibrosis. The autoreactive CD4 T helper cells are sensitive to thyroid antigens that initiated the death of thyrocyte by multiple immunological mechanisms. When your immune system tries to destroy your thyroid gland, it impairs your thyroid's ability to produce thyroid hormone. Could be with the underactive thyroid gland or pituitary gland that doesn't produce enough thyroid stimulating hormones. Most common is with underactive thyroid gland. Type of hypothyroidism. There are two types, primary and secondary. Primary type is about 99% of all cases. Hashimoto disease is a primary type characterized with reduced thyroid hormone and increased TSH and TRH. Clinical manifestations. Hypothyroidism generally affect the whole body system. It could occur over months or years. It is also with reduced thyroid hormone, it can cause lower energy metabolism and reduce the heat production. Symptoms could be with mild weight gain, cold intolerance, fatigue, and lower body temperature. It also can have diastolic hypertension. Myxedema coma. When the patient experiences symptoms like mental status change, hypothermia, respiratory failure, hemodynamic instability that could cause death, which can be precipitated by stress, sepsis, and trauma. When patient experiences severe hypothyroidism, it requires immediate attention for treatment. It is also can lead to excessive TSH production, which can stimulate thyroid tissue and cause goiter. Um, for how do we diagnose Hashimoto? We can use physical exams. We can check a patient's history and sense of symptoms of Hashimoto disease, just like the general symptoms we have talked about in the previous slides. Also, we can palpate the thyroid gland area and see if there's any enlargement or tenderness. We can also use blood test. Um, Initial screening with TSH is very much suggested because patient may present with no sign symptom in the earlier stage. T3, free T4, TSH, antithyroid antibody test. Typical lab value should be have increased TIH and reduced T4 level coupled with increased TPO antibodies. In our case, the patient has a correlated lab result. We can also use ultrasound or CTs. Histologic assessment with biopsy, fine needle aspiration, or thyroidectomy. Patient lab indicated a population of different immune cells with her needle biopsy with macrophage, plasma cells, centroblast, and lymphocyte. Thank you for watching, and this is the end of my presentation.